one of the reasons why I ended up starting Klinic. It was at that point where I started to talk to a lot of providers, both doctors and nurse practitioners around the country, and I would get this like recurring conversation and recurring theme in the conversation that would pop up over and over again, where people wanted the autonomy to work for themselves, but they didn't have the resources to be able to do so. Towards the end of 2021, early 2022, we said, what if we could just license our entire platform and make it available for a provider that wanted to build his or her own practice, and essentially give them the infrastructure to be able to build their practice on top of. That included, the EHR, ePrescribe, patient portal, practice management, all of the marketing software to run and grow a practice. And so our first customer, it was a provider that had shut down their practice during COVID. They were relaunching their practice on our platform, and we got them launched in January of 2022. We grew them from January of 2022 to December of 2022 from 0 to over 500 patients. Their revenue grew from 0 to over $200,000 a month in collections. So they were doing over $2.5 million a year in revenue by the end of the year. They grew from 1 to 3 locations. They started to expand the number of treatments and conditions that they were going into. We have now done this with over 100 practices around the country, where we have helped them to launch and grow their own practice. We started with Suboxone clinics. We went into psych, ketamine, TMS, ABA therapy, and that's really like everything within mental and behavioral health. And we've also done some stuff outside of mental and behavioral health, things like medical weight loss, hormone therapy treatment, chronic pain management, sleep clinics. We will give providers an option where if you want to do this under your own group NPI, you can, and we have ways of working with you or your external biller. And then if you want to do this under our group NPI, we can help folks get up and running with insurance in less than 30 days, essentially get them up and running under our group on a very unique business model.